Hi, my name is Mariah, and today I wanted to take the time to make a video and talk about a major part of my personal life, which is the rare disease known as Dercum's disease. I am a Dercum's disease sufferer. Please do not take any information in this video as 100% accurate because I am not a medical professional and I can only speak from the experience as someone who has this disease. I am not a doctor, I am just a girl with Dercum's disease. Thank you. So, what is Dercum's disease? Dercum's disease is a rare disorder of the subcutaneous adipose tissue. Rare diseases like Dercum's disease, also known as orphan diseases, are classified as affecting less than 200,000 people worldwide. While the exact number of people living with Dercum's disease is unknown, I would personally estimate that less than 5,000 people worldwide are currently diagnosed with Dercum's disease, and this is just my personal estimate, which I'm basing off the fact that I am in a couple different online communities or support groups for Dercum's disease. And between these two communities, there are roughly 2,000 people in them. Many of those people do not currently have an official diagnosis. So, accounting for the fact that I assume there are people who have diagnoses not in the group, and that we have a lot of people in these groups who are undiagnosed, that would just be like my ballpark estimate. But the exact data is completely unknown because Dercum's disease is rare and it is an orphan disease. And orphan diseases are diseases that are left behind in the medical community because of lack of knowledge and doctors who can treat these diseases and just a small population of people suffering from them. Obviously, funding and studies for medicine tend to go towards diseases affecting the most amount of people because the industry wants to put their money where it can aid and assist as many people as possible. So there are very few doctors out there who are specifically trying to make a difference for people with Dercum's disease. They are rare. They are out there. Dr. Karen Hurst is a big name in the Dercum's disease community. However, that is the only doctor I know by name specializing in Dercum's disease. And there are no doctors in my state personally who specialize in Dercum's disease that I know of. And I have, obviously, I am someone suffering from Dercum's disease, so this is something that I have been dealing with. I've been trying to find the right doctors, and especially during my diagnosis process, because I am officially diagnosed with Dercum's disease. So I just gave you a lot of information, so let's break it down. What does that even mean? A rare disorder of the subcutaneous adipose tissue. Subcutaneous means beneath the skin, so just directly under your skin. And the adipose tissue is the soft connective tissue that surrounds your muscle and your organs. And it also stores your energy in the form of triglycerides, which are a type of lipid, which is a fatty acid. I know this is a lot to take in. It is a complicated disorder, but if you think that you are suffering from Dercum's disease or know somebody who may be suffering from Dercum's disease, I think it is highly important that you just try to take it slow and absorb as much of the information as possible. So, adipose tissue is essential for your energy regulation and your glucose hematosis. So, glucose hematosis is the regulation of your body's blood sugar. A lot of people with Dercum's disease actually have blood sugar disorders like diabetes. I personally am not diabetic, and my blood sugar is managed. I think that is because I have not had much of a sweet tooth in my adult life. I worked at Cinnabon as a young woman, and since then I just not big into the sweets, and especially now because for somebody with Dercum's disease, you are extremely sensitive to sugar. So sugar is something that I choose to avoid like the plague. Now, there's something important to understand about adipose tissue. Somebody who is heavy set will have more adipose tissue, but even thin people have it, and it is essential for your body. Obviously, it stores all of your energy. And for that reason, somebody like me suffering from Dercum's disease, we have extreme issues with energy. I like to say that I start my day with about half the energy of everyone else, or that for my nerds out there, if you play D&D, I like to say that every day I have level 1 exhaustion, and sometimes it gets worse and the levels go up, depending on how bad that day is for me. So, the disease itself causes the adipose tissue to grow rapidly in the form of non malignant, which means non cancerous, tumors known as lipomas. Anyone can get a lipoma, they are not uncommon. But what differentiates Dercum's disease lipomas and regular lipomas is that someone with Dercum's disease will have numerous tumors or lipomas. I use these two words interchangeably. So somebody with Dercum's disease will have up to hundreds of lipomas, whereas an ordinary person who gets a lipoma will have one, maybe a couple, but an ordinary lipoma does not cause pain, and Dercum's disease tumors are actually extremely painful because they are so widespread and numerous. Ordinarily, like I said, a lipoma will only hurt if it grows so large that it begins to aggravate the surrounding nerves or press on your muscles. And usually with someone who grows a just random lipoma, you won't notice it for a long time until it becomes physically visible on your body. Whereas people with Dercum's disease, our lipomas often at least begin, and in my case currently still are, completely invisible. You cannot see my tumors beneath my skin. Whereas somebody with just a regular lipoma, it will be large and prominent by the time they ever notice it. So, like I said, Dercum's disease tumors are extremely painful, and as they grow, they become even more painful. The pain for some people can be constant, or for other people, it will ebb and flow. A lot of pain management is tied to diet, as Dercum's disease is resistant to medication. Dercum's disease is also aggravated by movement of any sort. So, your daily activities, what you have to do as a human being to survive, getting up to shower, taking your kid to school, in my case, like these things hurt your body every day. So, you have to be really careful to manage your activity and do essential activities and not wasteful activities, because when you have Dercum's disease, your body can only handle so much, and the more stress you put on your body, the more likely you are to have a flare. Usually for me, if I have an especially busy day, I am guaranteed to be in significant pain the next day. And for me, a significantly busy day can just be doing my daily activities plus going to the grocery store. Like, and that's not a lot for most people, but for me, because of my body and because of my difficulty with energy regulation, like that usually puts me at about my limit of what I'm willing or able to do for a day. So what is the pain like? When I was at my sickest and heaviest, I tipped the scale at 300 pounds. I was in constant pain. My skin, muscle, joints, and nerves were constantly on fire. I described it as what I expected it would feel like to be pulled through a wormhole in space. This agonizing, stretching, tearing, scathing, stabbing pain with spider-like sensations crawling beneath my skin and a lot of tingling numbness, particularly in my right leg and hip, which is where my disease began. Thankfully for me, when I was at my sickest, my disease was primarily in that area, and it was not widespread throughout most of my body like it is today. So while I was in a lot of pain, it was basically contained to that area. And while it was excruciating, it would have been a lot worse if it had been widespread through my entire body like it is today. So since then, I've lost nearly 100 pounds. That is something that I was completely incapable of doing on my own as somebody with Dercum's disease. That will sound like an excuse to a lot of people, because science tells us, and I do like science, that your weight is determined by calories taken in versus calories burnt. somebody with Dercum's disease who is not on medication can gain weight at a caloric deficit because our body produces fat incorrectly. Our fat grows in these mutated clumps of tumors, right? So somebody who, say, is working out a lot and has a caloric deficit will gain weight with Dercum's disease instead of losing weight, because the stress and pressure that that person is putting on their body by doing heavy workouts actually aggravates the tissue, and when the tissue is aggravated, it swells, and the swollen tissue is like a breeding ground for the lipomas to grow and to just spread. Like, they just get worse. Like, when I was diagnosed, I was working in asset protection. Part of my job was extremely physical. I followed people around the store to deter and apprehend them when theft occurred. So I was on my feet a lot, and I was following people around a lot, and my speed was determined by their speed. So if somebody was moving fast, I was moving fast. And during this time, I got really sick. Like I said, I was 300 pounds at that time, but I got to 300 pounds during that job. During that job, 1 year. In 1 year, I probably gained 50 pounds. I was not eating more than usual. I was not eating unhealthy foods. I have always more so strayed towards, like, we eat family meals, and I eat things like sushi and vegetables and, meats and whole grains. So my diet wasn't particularly bad. I've never been like a sugar consumer. We would eat fast food, but not outrageously, maybe once every other week or so. So my diet was not the problem. But as I said, since then, I've lost 100 pounds. And a lot of that is because I am very careful about my diet. So I'm not eating foods that inflame my body and make my tissue production rapider. I don't know, rapider is probably not a word. But, and I've also been prescribed medication that actually helps me instead of hurts me. I now only experience what I just described to you during flares. And these flares I get less often because I avoid sugar as much as possible, and I take a GLP-1 medication known as Zepbound, which helps fight the growth of additional tumors and helps regulate my glucose levels in my blood. So it helps regulate my body's blood sugar, which I did not have problems with. However, any level of sugar in my body is like essentially poison. Even with that being said, I still have constant pain. My body constantly feels very heavy, very sore. It's like I'm dragging myself through life a lot of the time. There are times where I have very little pain, but I never feel like a normal person. I'm not going to say normal person, because what is normal? I never have a day where I am completely pain-free. That is not how my existence is anymore, because I do have Dercum's disease, and it has changed a lot. Okay, so we've already been through a lot of information, and the video is already getting kind of long. So what I'm going to do is I'm going to cut this one short here, and I am going to make a second video where I will go into the more specific symptoms of Dercum's disease, because while what I described to you is a huge part of Dercum's disease and is essentially what Dercum's disease is, there are a lot of symptoms and complications and comorbidities that come with Dercum's disease that I'd really like to take the opportunity to talk more about. And since Dercum's disease is just so incredibly complicated and so understudied, I feel like it's important that I share as much of the information that I have gained as a Dercum's disease sufferer. I am not a doctor, so don't take everything I say as like the tea, the truth was what I currently mean by the tea. Don't take it like that. Always consult a doctor. If you can find a qualified medical professional who is familiar with Dercum's disease, work with them. And always put their knowledge above mine, because I can only talk from my perspective, and from my own personal understanding of this disease. If this video helps you out, I would really appreciate it if you leave a like on it, because that really helps with the YouTube algorithm to promote this video so that other people with Dercum's disease will be more likely to see it. And I appreciate that. Thank you for watching, and I hope you have an amazing day. Bye.